Welcome to Inside ISAPN, your source for all things APR in Illinois. I'm your host, Dr. Ep4, family nurse practitioner, and in today's episode, we are diving into the theme from clinician to leader and spotlighting the journeys of APRNs who have stepped beyond the bedside to lead in hospitals, academia, and policy. And today I'm joined by our ISAPN specialty representative for certified nurse midwives, the amazing Dr. Leta Vega, who will share her personal path to leadership, why she chose to serve on the ISAPN board, and her advice for APRNs who are ready to lead. As a certified nurse midwife, educator, and longtime advocate for women's health, Dr. Vega shares her journey from growing up in an environment with few opportunities for women to becoming a nationally respected clinician, professor, and ISAPN board member. We'll talk about the power of persistence and what it means to advocate for equitable care and why, now more than ever, APRNs must raise their voices. Thank you, Leta. I always love talking to you, so I'm so glad you're here today. I just want you to start off just telling us a little bit about your journey through nursing and to where you are now.
Well, thank you, April, and thanks for having me. I'm really excited about talking to everybody, and I'm just so excited that you developed this platform. This is great. It's wonderful. I grew up in a very small area in the central Illinois area. We had a small town, and my mother was very more Southern traditional because she grew up in the south part of the state where women didn't have opportunities. Women were they were stay-at-home mothers. They were involved if they were involved in community, it was through a church, maybe the schools, that type of thing. But she was also very focused on all four of her children going to college. So it was a given from the day you were born that you were going to go to college, which I'm very grateful for in that aspect. But you had two choices. You could be a nurse or you could be a teacher. And I ironically ended up doing both, but at the beginning didn't really want to do either. I just kind of wanted to be a stay-at-home mom and have babies. I absolutely love babies, love children. I babysat when I was young and all. So I chose the nursing route, thinking that it could be a part-time thing. The other ironic thing about my mother, and I won't talk too much about her, but her whole deal with going to college was not to have a job, not to have a career, but to have a backup plan in case your husband died. And that was why you went to college. She was terrified of losing my father. He was diabetic. And so I'm sure that played into it way back then. I was born in 1958, so grew up basically in that late 60s, 70s, 80s period. So it was very important for us to all have a fallback per se. My sisters ended up going into teaching. I went into nursing and ironically then teaching too. So started out in a diploma program in the area, then went on for my bachelor's. Then I didn't go to my master's until my children were in college. Let's see, my oldest two were in college. And we were all at the University of Illinois at the same time. So that was very, very fun. So I ended up choosing midwifery for a couple of reasons. Number one, going back to the baby part, that's what I did. I focused in pediatrics and labor and delivery. Only worked part-time, never worked full-time, just kind of worked on different aspects, but then did as things evolved and ended up having to support a family through a divorce. I worked in home care and started my own practice. Not really a practice, I guess, my own company, home care company, sold that, and then worked my way up for another company into upper management, vice presidency of that company, and then had the opportunity with the CNM program being new in Peoria that I put my hat in the ring and was one of the first graduates of that, where we did kind of like this Zoom, but it wasn't Zoom back then, but we did these recorded lessons, and also taking that from Peoria, but then coming up to Chicago and doing clinical aspects. So ended up as a midwife, went back for my doctorate, and that's how I got into teaching. I wanted to explore that opportunity, and I was awarded a grant that, not really, I guess wouldn't be a grant, but a way of paying for the last part of my school by agreeing to teach for 2 years. And that was through the University of Illinois, and I started doing that. So here I am.
You are doing both of the things. And that's what I tell people all the time. That's the beauty of nursing, though. Like, you can be clinical, you can teach, like, you just have so many opportunities to do different things, but still, creating change.
I totally agree. Totally agree.
Mhm.
Yes.
So, since you've been in academia for a little bit of time, and I know like we've had a lot of changes, of course, what kind of things are you seeing differently from when you first started teaching to now within like nursing education and clinical
Oh,
experience?
great question. When I first taught, we did not have true online teaching in nursing. You kind of could do a hybrid type of situation, but it was, I'm trying to think of the name of the school that started the online. You probably know the name of that. Um, oh my gosh, I can't think of the name.
Oh,
The first online
the
college
program.
program. But anyway, I did take a couple of those classes, those online classes, but that was back in the dial up,
Oh.
the AOL.
Yes.
So literally, I would go downstairs, turn on the computer, go upstairs, make breakfast for everybody. And by then, the computer was turned on that you take your
Right.
class. But it was not, there wasn't any, it was flat. There wasn't any interaction. It was page by page because it was very old school computer wise. It was the DOS program. Yahoo was at that point. There was no Microsoft Word was brand new. So you would write your papers and submit it. That's basically all you did was papers. There was nothing to do with clinical. Clinical was all on site still. All of that was, you would never do, it wasn't even thought of that you would do clinical. I was from a diploma program. So by the end of my third year, I was on the floor 4 days, 8-hour days, four days a week, 8 hours of those. And I think that's what's missing nowadays is that clinical experience. I I would ideally, I think a 4-year program with a year of residency would benefit and behoove nurses in general. I think that would probably eliminate a lot of that fear that they have in the beginning because they're just not exposed to much. And you're teaching now, right? You're still teaching.
I am, and I'm
So,
teaching advanced health assessment, and they do video, and it's so
yes.
different than when I did mine. Like I said, I had to be in person when I did my competency in person. I did to do head to toe, and they get to do them in 3 20-minute blocks. So they split up each, different sections, and it's just so different on Zoom because it's kind of like, is that the correct placement? Is like, can I really see your technique? In a way, I like it because it does give some students an opportunity who maybe wouldn't be able to get to clinical. It gives them some additional opportunity, and this is the day we live in, right, with technology.
Right.
But it's just so different than what we're used to, and I do think that some people or sometimes that may prevent us from, like you said, that in-person experience. That
Mhm.
it's just a different level, and so that's what I worry about sometimes is just making sure the students can have that patient clinician relationship because they're doing it
Mhm.
on computers with someone they know.
Right,
Yeah.
right, right. Yeah,
Yeah.
our program, I won't say it's flat, but it's interactive in itself, but I don't know anybody. I don't see anybody. I don't know if they're male or female. I don't know anything about their ethnicity. I just have a name. And on one part, I like that. Everybody's treated the same way, graded the same way. But on the other part, it's hard because we do have a lot of foreign students. So I'm trying to help them navigate not only the program and Blackboard, but also just English in general. The program I teach in right now, that my main focus is the RN to BSN program. So these are already nurses. They have their ADN. And the ADN programs do provide a fair amount of clinical. It's pretty intense. So I think that's good. I've taught in the DNP program a lot, but right now I'm not doing that. I'm just focusing on the other because we're revamping and rewriting our courses, so I'm not able to do much more than that.
Okay. Yeah.
So I taught for Chamberlain a little bit, and their program focuses more on clinical. It's a 3-year bachelor's,
Okay.
but their clinical is very intense. They
Yeah.
do 12 hours, and they have a lot of high expectations. So I thought that was very good.
Yeah, and it's one of the things too. All the programs sometimes are a little bit different. They have these core things, but a little bit changes here and there between the different programs, and so
Right.
but the accessibility of online, because I got my bachelor's online. I started an ADN program, and I was able to do my bachelor's online, which was definitely again beneficial because I was able to work and all these things. So that accessibility by having things online definitely just opens up so many more doors and access to education. Same thing I say about ADN programs. I say we definitely need those because if we didn't have them, I wouldn't have been able to go to a 4-year university.
Exactly. And I like the way that they're dovetailing it all together. So we have, I teach for UIC, and so we have partnerships with I'm not even going to say the right colleges, but with a lot of the ADN programs in the area. And so they slide directly into our program from their program, but they are required to work. So that's part of the requirement because that takes care of our clinical piece per se, and the fact that they are working. Plus, we require them to apply the learning to what's going on in the clinical world. So you can't really do that if you're not working.
Okay.
Yeah.
And then one other thing I know, like we talked about how you love the babies. And so was there any other area or niche of nursing that you thought you might have wanted to do, or was it always babies?
Always babies. I did not like mental health. Freaked me out. I didn't like med surg. I would say I liked OR. I thought that was kind of cool and fun. But my type of personality, I would get very anxious if anything happened. That this is terrible to say, but if there's like a lot of blood and guts and gore, and then here I go into labor and
delivery.
delivery.
Babies, right? You're delivering babies.
That's kind of controlled and a little bit different.
Yeah, it's a little bit different. That's fine. I know it always amazes me, like, that we all have a niche of something you want to do. And sometimes people know right off the bat, oh, I absolutely want to do this. And then some of us are like, oh, maybe I want to do this. And maybe I want to do this. And then you're like, no, I don't want to do that.
Right. Exactly.
But there's a place for us all.
Exactly. And that's so wonderful. Right? How could we provide care for everybody if everybody wanted to do the same thing?
Same thing, exactly. All right. So thank you for sharing your story and kind of like how you got here. I'm definitely glad that you're here. I'm glad you are CNN Midwife on the board. It's been so great working with you and getting to know you on the board. So that's been really great. So now we'll talk a little bit about ISAPN and kind of what led you to join the board.
I joined ISAPN way back when I moved here to Chicago. It was an opportunity for me to meet people by going to the regional meetings. It was great. I knew no one up here. I knew my children up here. I was older. Chicago, even though you would think it's a big city, I'm living in the burbs at the time. But it's hard to meet people. It was really, really challenging. So I started to go to the meetings and met a lot of people. And that was the time when we were working on full practice authority was just starting to be talked about and all. I thought that was cool. I just became friends with some people, and that was before Susan was around, but there was somebody else also. So met them. I had been, as I said, in one little facet of my life, I had done home healthcare, and I had been on both the state and national boards for the Home Health Association. So I was had some background in that. And then I joined the legislative committee and worked on the powers that be to get us to full practice authority, and it was fun. Susan reached out to me and asked if I wanted to be a CNM rep. It had been a little more challenging before when I was actually doing much more clinical and doing deliveries and all. It's really hard then. But now I'm not doing that anymore. I'm just in the office. And so I accepted. I am so glad I did. I
Yes, me
really
too.
enjoyed it. I've enjoyed everybody on the board. It's been so much fun getting to know everybody. We do fun things. The meetings are even fun. So yes,
Yes, we have a
it's
lot of
been
fun.
very positive.
Yes. And so I know last year you kind of spearheaded the task force. You were like the lead for the task force. You volunteered to help create our new mission, vision, and core value statement. We had a purpose statement before. And so last year, one of our meetings, we had talked about how we really just wanted to be sure that we were connected to our members and to the state. And so I know you spearheaded that. So just tell us a little bit about what that was like, and how did you all, your group, come to, decide what was important to include?
I think what my takeaway for that, Susan gave us all that book to read about the importance of organizations in the fact that way back when, I don't want to say how old I am, but joining an organization was again a way to meet people, and it was much more popular to do so. I don't want to say easier because we actually had to go to meetings. Now we do them on Zoom, but it was just a different way of thinking. Whereas now, in reading that book we had and all on the difference of the younger generation wanting to be asked, wanting to be involved right away. That's hard to kind of wrap your head around when you're more old school. And it was like, well, you have to earn your place. You don't get to like come in and just run the show. But in a way, why not? I mean, really looking at it, so what? So what that people are new? They have the fresh ideas. You can see that across the board in any corporate organization. You want the young people involved. You want the fresh ideas, no matter how old you are. You want that new life. And so looking at our mission and vision changes, I think that's what we're promoting now. We're promoting that, looking at access to all and being more readily available to accepting everyone's thoughts and ideas. Not that we didn't before, but the way we look at it now is encouraging. Is come on, welcome. Let me hear what you have to say. That type of verbiage and introducing people and all. I think is just stellar idea.
Yeah,
Why didn't we do
absolutely.
this before? I don't
Right.
know.
It happens. And I always tell people, like, when you are a part of an organization, you do want to look at their mission, their vision, their purpose, to see if that aligns with your mission and vision and purpose. Because if it doesn't, that, especially if you're going to be like a board member or leader, it may not match, and you may not need to lead in that particular organization if they don't match what your personal mission, vision, and core values are. So that's very important. So I think this mission statement that you all created was amazing, and it really, like you said, represents all APRNs in the state. Us doing education and advocacy for the state, and that's really important.
I think those are really good points. And I think too, back in the 90s, even 80s, late 80s, 90s, mission, vision. That was, those were trends. But, and now we don't focus on that so much anymore. But I hope that it comes back, because it's exactly what you said. It is so important, and people have to understand what even that entails. What do you mean by that? So, and it's a way of thinking about what you want to do and what you want to bring to an organization and what you want to bring to your own personal clinical practice. So yes, I would completely agree with your statements.
And then backtracking a little bit too. So we talked about health access for all, which is one of our goals, is making sure that the people of Illinois have access to health care. What does that look like from a CNM perspective? So for women, what does equity look like of healthcare for women in the state of Illinois specifically?
We are so lucky to live in Illinois, because we have a stellar governor who is dedicated to providing and keeping that access to healthcare. My personal feelings is, I wish that everybody in every state had the same type of vision. It is just crushingly sad that we as women right now aren't equal to men for a variety of reasons. And in healthcare, that translates for Black, brown women, poverty, people that don't have the higher socioeconomic, but you can still have a higher socioeconomic, lose your job, your husband leaves you, or something happens and you're thrown into a situation where you don't have access to healthcare anymore. You've lost your something that you've taken for granted. So I think it's so important that we have it for everybody. My personal feeling is healthcare is a right. It's not something that should just be accessible to only the people who can afford it. That breaks my heart thinking about that. And I see it every day. I flip back and forth. I kind of have a dual role in my in the practice that I work with. I run federally qualified healthcare. So I see the more lower income patients in their pregnancy, and then I flip, like, yes, tomorrow I do both in the same day. So then I flip to the upper echelon people that have access to everything. And it's hard. It's hard to see people that just have no idea the struggles, and you have to choose. These women have to choose whether to feed their family or pay a taxi to come to a visit.
Yeah.
And it's just heartbreaking. So I want everybody to have it. And that's the one part I come home in my day and I think, I have given the best I can. I provided everybody equally with the same care, and I'm trying really hard not to bring it home emotionally.
Yeah. And that's one of our nursing, I wouldn't say flaws, is what makes us so compassionate. We have this giving heart. We want to help everybody, and we want to make impact within, people and populations. And sometimes we can't, or a lot of times we can't. And that's the hard part. It's kind of like, oh, I can't do anything. There's nothing I can really do for, this one person or this person or this. Sometimes it's tough.
And you really have to, I think that's an art, in the fact that you have to take care of yourself. It's the same old adage. If you don't take care of you, you can't take care of anybody else. You got to put your mask on first before you can help the person next to you. In the plane, when they say, you got to put your oxygen mask on first, you have to do that. But you have to, in order to be able to do it every day, you have to be able, I don't want to say put up walls, but you have to be able to put your silo and say, I did the best I can. This is all I can do. And I know this is better than doing nothing. I wish I could do more, but I can't. So I'm going to work for trying to be able to give more in the future.
Yeah. And then you hang out with other colleagues and we talk and we support each other through those things.
Exactly. Yes, with a little wine and
Yes. A little music and we dance it out. Yeah. For me, that's one of the reasons why like I love connecting and networking with people from all, everybody on the board is in such a different special, everybody's in a different specialty and has had all this experience. But at the end of the day, we all have our own struggles and we come together. It's just like, whoo, like we just have all this stuff to talk about. It doesn't matter where we work, we have something to talk about. And that to me is therapy. That helps me to kind of just like let some of that stuff go and get over it and know that somebody else has been through something similar. It just helps to be around your colleagues, that community. I just love it. I love it here in this community.
Yes. And that's so true. I've learned so much from people. Every time we get together, I learn something new. Or think about, wow, I didn't know that. That's something to think about, a way to do something or a way to talk to somebody, or just like you said, hearing other people's experiences. You get kind of isolated when you're in your own specialty. All I do is talk to other OB-GYNs. I don't get the opportunity to talk to people who work in med surg or even work in a hospital because I'm just in an outpatient clinic now, or I teach online. So yes, you're so true on that. And that's what I like about the in-person things now. I don't care what anybody, you can't really do that on Zoom. It's not the same because you're always waiting for somebody to talk, where when we all get together, we all talk at once.
Right. And we keep up. Yes, it's definitely different. Like Zoom has been helpful, but like you said, that in-person thing, there's nothing like being in person and just, seeing people. I met someone the other day I've been seeing on Zoom for the last few months, and he was like so tall. And I'm like, I would have never guessed. Like, so it just like makes it stick better in your brain too.
Right. The only advantage on Zoom is you always know the person's name. Where in person,
you might have to ask. Yeah. And so so then being on the board, so is there anything that you have that you wanted to accomplish coming into the board that you haven't, or that you still want to do before your term is up?
I want to get more students involved. I want to get more new grads involved for this exact reason that we talked about. New grads are already behind the eight ball in the fact that they're new grads. They're intimidated, they're scared, like we all were. And just having that community, like you said, of other people in this, that they still remember that same boat, even though we may be very seasoned now. But I think it's so important that we somehow get them more involved. And it is a challenge. I think the new grads are overwhelmed and they don't understand maybe all of the positive attributes. So I've been reaching out to the college and putting out information about it to hope get some more interest. So that's what I would like to see. That is the one thing that I feel is really lacking. And I believe it's like that in all organizations, not just ours.
Right. Yeah, students, like, and then with them being online too, sometimes they don't have that connection.
Right.
And so that this being a part of an organization becomes last on their list of all the things they have to do. So, but we need you students. We need you to be here because we need your fresh ideas and your innovative thoughts.
Exactly. Yes. And we need to convey that to them, that we do want them. We do want their presence here, not just as a body, but we want your interaction. We want to know your thoughts. We want to know your ideas. How can you help? How can you help us? How can you help us be better?
Yes. And so anything that you would leave to people who are thinking about, I don't know if I want to be part of ISAPN. I don't know what its it would be beneficial for me?
I think I would I believe it's important that we invite people and bring them. I have been talking to people. There's like three people that keep saying to me, "Oh yes, I'm going to do that. I'm going to do that," and then they don't. And I have invited them. Come on, I'll take you to one of the regional meetings. Let's go. We get a meal, we can have a drink, it'll be fun and all. And oh yeah, let's do it. And then it doesn't happen because of schedules or whatever. So that is what I'm working on. And that is my goal, is just to try and get more
Get more
people.
people. I know, and again, sometimes people feel like, oh, like I don't have time and it's not a priority. Not knowing really what the benefits are.
Right.
Like for instance, like this legislation for this year, we just recently fought for and had passed with certified nurse midwives.
Right.
And so, like just telling people like this work continues regardless of if you're a member or not. It's going to benefit all APRNs in the state.
Mhm.
And what people need to understand is we need you, not just to be a member, but we need your voice. We need to know what your struggles are in your clinic setting, or in your community, that possibly we can help out with. Because if we don't know, we can't help. And if we don't have enough members, uh, we sometimes it just kind of limits our voice. And so that's kind of the biggest thing. But people hopefully will start to realize that being in a professional organization is your professional duty. Like it's a
Right.
necessity. It's not optional. Like there's things I'm sure everybody wants to happen in their clinic or in their community that's not. And everybody's always like, well, somebody should do this. Somebody should do this. Well, I tell people all the time, well, you are that somebody. That's why you need
Right.
to come and you need to talk and you need to share and you need to join and you need to speak up so that we can help you together so you're not alone.
Right. As you were talking, I'm thinking it's almost like a political grassroots situation where maybe we need to actually go out, physically be present and introduce ourselves and talk, not on a Zoom, not emailing, but actually going to sites and meeting and personally going over to the schools. Now that I'm thinking about this, they do still have didactic classes. What
Mm-hmm.
a great opportunity to even just sit out in the lobby and
Mm-hmm.
say, hey, this is just some information. This is what what we want to do. I That might be something maybe
Mm-hmm.
we could think about for
Yeah,
future.
I know the membership committee, they have each person on the committee has a school assigned to them for outreach. Um, and so sometimes it's hard to get into the school. Sometimes you don't know who to contact. So if anybody works at a school and you want us to come and talk to your students or, share information, we're always willing to do that. We need a name, we need an end. But
Yes,
yeah, that's
yes,
like you said, just showing up is a big thing for sure.
I agree. And also maybe out in the community too, just
Mhm.
having a booth at fairs or street festivals or something like that. So in down where I am right now in downtown Arlington Heights, before they tore down the racetrack, they used to have a big festival, but it focused more on healthcare, people's businesses. So you could set up a booth that was
Okay.
very inexpensive and promote your entity per se. So there was a great variety of people that did that. Maybe there would be some opportunity for us to do that.
Yeah, because people still need a lot of education on what APRNs do, or
Exactly.
they don't know. A lot of people don't know. So
Right. And there's a lot of outreach. I go to the street festivals. I don't know. Do you go to any of the street festivals?
sometimes, yeah,
Yeah.
once in a while.
So there's a lot of outreach from the spinal people. You want a free spine check,
Oh, I've seen that. Yeah.
and then a lot of them will do a massage too. So great impact. But they're always there. They're always there. And that now there's a lot of outreach with the prep. So there's
Mm-hmm.
the healthcare clinic that runs the prep. They go to most all the festivals and have
Mm-hmm.
people there and talk about it. So it's something to think about.
Mm-hmm. Yeah. Well, thank you, Leta. Any last minute words you want to leave with our audience?
Oh, I would say thank you so much for watching. Thank you for your interest. If you're not a member, come join us. If you are a member, get involved on a committee. If you're already doing that, reach out and tell somebody what a great organization this is. And
Yes.
April, you have done a phenomenal job as a president.
Oh,
We
thank
will
you. Thank you.
miss you, but we will welcome our new one.
Yes. Nominations are open currently. So if anybody wants to submit their hat in the ring, it's open.
Yes.
Okay. Well, thank you so much, Leta. Sharing your journey with us, your impact, your being a nurse and a teacher stories with us. And as everybody has heard, like leadership doesn't mean you have to step away from patient care. You can be a leader in academia and a leader on a board and still do some patient care. It just means you're expanding your influence so that you can shape the future of healthcare because APRNs, we are healthcare. And so if you are an APR ready to lead, remember that ISAPN is here to support you, whether it's for advocacy, mentorship, or connecting with like-minded professionals such as us women here, our APRNs here. Your membership helps us to amplify your voice. And so visit isapn.org to learn more and join us in advancing APRN leadership across Illinois. Thanks for tuning in to Inside ISAPN. Until next time, stay informed, stay inspired, and keep leading forward.